Changes have you made to adjust to the conditions of COVID-19 pandemic? Me personally, I became homeless before the pandemic, so I didn't necessarily have to make any changes other than the norm, which would be wear a mask, wash your hands, make sure that you are clean most of the time, so you can try to avoid, the disease or the virus. So that's really all I've had to do. But things that I would say have affected me from that would be a lot of the places normally as a homeless person I would go to get out of the cold or get out of the weather have been closed to me. So I can't go into Starbucks to sit down anymore when it's really cold or snowing or raining outside anymore. I have to find other solutions. Can't go into Whole Foods. So I can't really, they've cut off my ability to get out of the elements. So that's one big change. And then also, just like everyone else, wearing a mask or staying extra clean all the time, make sure you wash your hands, all that kind of stuff. If I can't go into these places, use their facilities, I can't do that either. So they have put wash stations out, but they don't fill them. And, so it has been harder.
In March of 2020, the world would have ever changed. COVID-19, the coronavirus, will have become the new pandemic.
Around the world, there have been 121,564 cases.
The number of cases in the U.S. rising over 2,000, at least 49 deaths.
African Americans and people of color are dying in the pandemic, and it's just a disproportionate amount.
Congress has appropriated roughly $175 billion so far to help hospitals and other healthcare providers weather the consequences of this COVID pandemic.
Another thing that is particularly alarming that some doctors are now seeing is that mortality rate also means that younger Latinos are dying at a disproportionate rate.
When you look at the predisposing conditions that lead to a bad outcome with coronavirus, the things that get people into ICUs that require intubation and often lead to death, they are just those very comorbidities that are unfortunately disproportionately prevalent in the African American population. So we're very concerned about that. It's very sad.
And the doctors have noticed a worrying trend. Many of the patients are people of color.
The disparity in the funding of healthcare that has happened over decades in the city of Chicago. While I've seen Medicaid dollars flood out to resources in the suburbs, to multi-billion-dollar corporations, hospitals like Roseland have been underfunded.
This is the 10th hospital that I have been in, and to see the way that these families have to live after this and the heartache that goes so far and so wide. It's really hard to take. It's really hard to take. It's really hard to take.
The coronavirus changed the world. It changed our everyday habits. It heightened our senses to our surroundings of who or what was around us that seemingly was out to harm us by a breath of no longer fresh, but a contaminated air. Many of us became paranoid at the sound of a cough and assumed it was flying within the air we stood in. The battle was unfolding between the anti-maskers, the conspiracy theorists, the mask wearers, and those who took the safety protocol to the next level of being COVID safe. The coronavirus showed it was not biased in its victims, but somehow within the minority communities, it was told that COVID-19 could not affect black people. It was an untruth that proved to be very wrong. Who started that rumor and why? Did that information affect the way black people took to the coronavirus's impact? In fact, After many weeks of the virus's introduction to the public, different media outlets and private studies were finding that minorities were dying or being affected at a disproportionate rate. Why? What was different? And if true, what could be done about it? We asked the public and some residents of the community, in your opinion, do you feel as though COVID-19 has disproportionately affected the minority community more than any other communities? And if so, why? Although very hard to not be convinced by media influence, we wanted to get answers from those who form their own opinions. Here is what they had to say.
I feel like it affected the African American and Latino community more than others, as I have witnessed it in the healthcare field. A lot of the African American ethnic patients were passing away more frequently than others, and for that reason, I'm not sure why, but for my own personal reasons, I did experience it more than other races.
Yes and no, because I've been hearing more and more Black and Latino celebrities dying a lot more. I've heard of some Caucasian celebrities, they'll have it and then sooner or later they'll get over it.
I would say yes, and that would be because in any system or in any society, you have your top and you have your bottom. In American society, Black and Latino are at a lower rung of society. So yes, they're going to be disproportionately affected by negative things in the society, more than the people who are at the top rung or at a higher level. So yeah, I would say yes.
I'm gonna have to say yes with that. I remember when the COVID virus really started picking up and amping up, like March, April, May, and I do recall NPR and a couple of news stations bringing CDC statistics to the table, saying that it was true that there was a higher death rate in African Americans and Hispanics. And I do know my husband is Puerto Rican and his family is in Puerto Rico, and they will not fly here, they will not come here, they are staying home because they know that their chances of being Hispanic, of also picking up catching the coronavirus and it being a bad case, possibly of mortality, they won't fly. They're staying home, they are just staying by themselves. And I'm not a scientist, but there are certain news stations that I do honestly believe in, scientific magazines, and they've been saying that since the beginning. So I have to say I do agree with it.
Yes, because they discriminate against the whites and the blacks and the Puerto Ricans because they think that we was the ones that is giving this COVID to everybody.
I think that it has, because mostly in Latino communities, it's mostly family homes. So having a lot of people living together, it's very difficult to follow the guidelines by CDC. Also, Latinos are more prone to having pre-existing conditions. So not following the guidelines and also having all those pre-existing conditions and just working a lot outside. Mostly it's one family, one person income family. There's only one person working, so they have to go to work every day. You know, even maybe other people with degrees or with a trade have the advantage that they can work from home, or maybe they had money saved or something like that. But when you live paycheck to paycheck, you have to go to work every day, and you can't follow all the guidelines.
I believe so, yes. The reason why, there's several different types of reasons. They're all pretty much similar, but Black people don't trust the healthcare system in general. So treatments and things like that, people in our community are kind of fearful of. They don't trust it, and also having access to it. Transportation to get to the doctors, how far the doctor's office is from. where we are and things like that. So there's a lot of issues with access and trust.
Many do see the disparities of the coronavirus and its impact on the minority communities. But how much do we know about the virus or its vaccine to prevent the spread? In fact, many African Americans shun from the vaccine because of an ugly medical history, like the studies that were conducted on African American males with untreated syphilis, multiple gynecological procedures practiced on African American women, or not having consent from an African American family for a medical breakthrough from tissue samples taken from a cervical cancer patient. Time published an article that read, Washington stated, people tend to underestimate the extent and breadth of this. Washington says, there's no sphere of American medicine that was not touched by the use and research of African Americans. We had the pleasure of interviewing Northwell Health professional Dr. Brown as she took time from her busy schedule to answer some of our questions. Her dedication and focus in spreading awareness of COVID-19 and stopping its spread with correct information was very apparent in her sincerity to give answers and recommendations. Let us listen in and learn more about the coronavirus and its effects and ways we can work together to prevent its spread.
So COVID-19 is a very serious virus, but it acts just like every virus we've ever known in that it spreads from one person to another and then infects the cells of your body. The problem with coronavirus 19 is that it is causing people to be much sicker than the normal viruses that we typically deal with, like influenza, which is a serious virus, but maybe is not fatal to most of the people who get it. With coronavirus, unfortunately, even though it's spreading the same way as flu does, which is right directly from one person to another, it's causing many, many more people to die. And unfortunately, it's become in the top 3 leading causes of death across the country at this point. So it's really hard to understand or know exactly when coronavirus came to the United States because probably it was here for a long time before we even knew what coronavirus was. We knew from as early as the fall or winter of 2019 there were cases in China, but exactly when the first cases happened in the US will be hard to know. Certainly we know that by January or February of 2020 there were confirmed cases of coronavirus in the United States. So that's a really important question. Like most viruses, the people who are most likely to have harm are people who are already medically unwell. So very old people, folks who have a lot of different medical illnesses, they are the most likely to be impacted or have like the worst outcomes. And when we talk about outcomes, we're really talking about having to go to the hospital, we're talking about needing oxygen to live, we're talking about being in the ICU, and then of course we're talking about likelihood of survival. So those patients continue to be the most likely to do poorly from COVID, but unfortunately the other thing we've seen in COVID is that people like myself, Black and brown folks, have done much worse with COVID. And the reasons for that are multifactorial, or there's like a lot of reasons we think that that's the case. Health disparities are the disproportionate outcomes for patients based on particularly race and ethnicity, but they also come from a place of lack of healthcare equity. And when we think about healthcare equity, it is that every person should have the same access or the same ability to be healthy as everyone else. And what we understand in the United States, unfortunately, is that we don't have healthcare equity. That two different people, based on their race, their ethnicity, their socioeconomic status, are going to have a different ability to be healthy. And we saw that over and over again in COVID. Some of that came from the understanding that many Black and brown people were essential workers, so much more exposed to the virus, much more less likely to have jobs where they could just be at home, right? So if that's the case, your access to health is less than someone else who isn't a frontline person, who isn't, making sure people are getting transported appropriately. So right away we saw that there was an increased level of exposure. then there are multiple other sort of effects, but I think some of the more dangerous ones are the ones we are really trying to overcome as a healthcare system right now, are then what happens when people come to hospitals, right? And this concern that people are potentially being treated differently based on the color of their skin. And this, in some ways, this is probably one of the most important things that's come out of COVID, is that we were seeing not necessarily that there was overt issues there, but in the outcomes that things were different. So we had to take a very hard look at ourselves as a healthcare industry and say, what is going on here and how do we stop this from happening? The things that we already know about what stops COVID-19, none of that has changed. So the effectiveness of wearing masks, the effectiveness of social distancing, the effectiveness of all the hand washing, the hand sanitizing, all of that works. And when we do that, the cases go down. And it's very clear when the cases go up and they get worse, it is because we are coming together. That's why we see a big spike after Thanksgiving. That's why we continue to worry about more and more cases happening after the Christmas and New Year's holidays, because despite a lot of the warnings, people, for a variety of reasons, are getting closer together. That's why the vaccine is going to be really important, in addition to continuing to do what we know is effective as far as mask wearing, hand washing, and social distancing. The vaccine is highly effective, and if there's one thing that the viewership I want people to hear, is that this vaccine is not only highly effective, over 90% effective in both vaccines that are currently authorized in the United States, but they are incredibly safe. These vaccines were tested in tens of thousands of volunteers, and there were very few adverse effects from the vaccine, while there was a 90% efficacy. Right now in the United States, we have vaccinated close to 3 million people with only a handful of adverse events. That's like getting an allergic reaction after the vaccine. And in those, not a single person died from that. So no one was so allergic to the vaccine. When I told you before that COVID is now emerging as one of the top 3 leading causes of death, the kind of, when people are weighing their risks and balances, risks and rewards here, it has to be sort of regarded that your chance of dying of COVID is so much higher than any risk from the vaccine. And really the vaccine is our opportunity to get healthcare equity, to decrease these disparities in outcomes, because once you're protected from the vaccine, you're not only protecting yourself, you're protecting your communities, and you're protecting yourselves from those outcomes that were disparate, the hospitalization, the oxygen, the ICU, and the death. So the vaccine just is going to be critical, and right now we have a lot of very good safety profiling on it. One of my biggest fears is that because of the legacy of the treatment of Black and brown people by the medical community, and we are talking about everything from Tuskegee, however many decades ago, where Black people were experimented on, to right now, where we see poor outcomes in Black women, including Serena Williams, who are having babies in this country. This has created a deep distrust, which we cannot ignore because it is real. Having said that, the major problem with that is that now that is going to become a barrier to people getting what is the most effective preventative for a disease that is more likely to harm Black and brown people than non-Black and brown people. So all I can say is that I have gotten the vaccine. I have convinced everyone in my family, both Black, white, brown, everything, because the data is strong that this is safe. And what we don't want to happen is that our Black and brown communities are not getting as good care because they're not taking the vaccine. It is effective, it is safe, and trust me, this is why, on Capitol Hill and everywhere else, they're lining up to get it. And that would not be the case if this vaccine was not safe. So one of the things that's really important are organizations like doing something about it, because it does start at the local level, and the only way people are going to have trust is if people who they trust are giving them the right messages, are giving them information that is empowering. So organizations like doing something about it that are empowering people with tools, with information, it's critical. So what I would really sort of hope anyone watching this gets organized, gets the information they need, contacts community groups, church leaders, whoever you trust to get good information, because there is going to be a lot of falsehoods flying out there, and really getting information from sources that you trust are really important. And really being that change you want to see in the world. So being a leader in your community, doing the right things, doing the mask wearing, the social distancing, as a an ambassador for here's what we want to do, here's how we're going to do it right together. So just super important, these kinds of organizations and getting information out there.
I'm proud, dark child, well endowed, just proper. Ladies stand up, pump it up, I gotcha. Yeah. Fellas stand up, ambitious and shotters stand up. Man up for your progress, and you should teach them early to learn the stage. To stand up, niggas is missing vertebrae. They can't walk, talk, but eat. Listen, if you ain't a stand-up man, then you don't even stand a chance on the streets. My position's firm, like I'm standing in cleats. B-boy stand on my own 2 feet. It's the Genesis, aka R.O.B. That stands for reality out of Belport streets. Rhyme on beats, rising over barriers in front of me. I cannot stand the cowardice. I ride on beat, reaching out and beyond like I'm on.
Y'all be careful, watch everything. Like I always say, God bless you. And thank you so much. All praises are due to God. Thank you.